The Senator from Middlesex, Mr. Lewis.
Thank you, Mr. President. I'm very pleased to rise this evening in support of Amendment 529, which reauthorizes the Prevention and Wellness Trust Fund. This is a first-in-the-nation program which we created back in 2012. We would not be in this position and able to pass this amendment tonight were it not for the creative problem-solving of the chair of the Ways and Means Committee, and I really want to thank her and the staff of the Ways and Means Committee as well for their hard work the last several days. Also my staff. The Majority Leader has been an incredible champion for all her years in the legislature when it comes to population health and prevention and wellness. And one of the things I've enjoyed most in my time in the legislature has been working with her on the founding and chairing the Prevention for Health Caucus. So I want to thank her as well. And I also want to thank the Senator from West Springfield, Chair of the Healthcare Financing Committee, who's also been a great champion on this issue. So thank you to all of you. You know, Ben Franklin famously said, "An ounce of prevention is worth a pound of cure." Prevention can help us stay healthy and enjoy a higher quality of life. And importantly, an ounce of prevention today can avoid higher health care costs tomorrow. We're all rightly proud of the fact that our state is a leader when it comes to health care reform and that we lead the nation in near universal access to health care. And that's a major accomplishment that we rightly celebrate. However, I think it's also fair to say that our health care system, like the rest of the country, is probably better described as a sick care system rather than a well care system. We are pretty good at taking care of people when they are injured or they're suffering from an illness or a chronic disease, but we're not very good at helping people to stay healthy and out of the doctor's office or the hospital in the first place. Only about 3 to 4% of the total resources that we spend on health care are invested in public health, population health, or prevention. And while factors including a person's genetics and the access they have to health care are important in their health outcomes, the social determinants of health are far more significant in determining a person's health status over time. Of course, in this debate over the last few days, we've talked at length about high and rising health care costs. It's a major, major challenge facing our families, our businesses, our municipal governments, and our state government. It is responsible for squeezing out investments that we all want to make in other areas of the budget. Well, preventable chronic diseases account for as much as 80% of health care costs. Let me say that again. Chronic illnesses that are preventable account for about 80% of all the money we spend on health care that we all pay for. Take, for example, the epidemic we're facing right now of type 2 diabetes. Since 1990, the percentage of our residents living with diabetes has doubled, rising from under 4% to over 7%. The medical cost of treating somebody who's suffering from diabetes is 2 to 3 times greater than a person who does not suffer from diabetes. And in Massachusetts, we now spend more than $3 billion a year in direct medical costs treating diabetes. So that's why in 2012 we took a very important step forward when we enacted Chapter 224, which was the health care payment reform legislation that we all worked very hard on. And as part of that legislation, we created the Prevention and Wellness Trust Fund, and as I said earlier, it was the first in the nation of its kind. We capitalized the PWTF with $60 million in funding. That came from an assessment on insurers and on certain large providers. And what the Prevention and Wellness Trust Fund does is it provides competitive grants and not just small grants, not micro grants, grants that are of a really significant size that can make a real difference. And it funds community-based partnerships that are typically made up of municipal governments, sometimes local boards of health, healthcare providers, often community health centers or hospitals, and then other community-based groups like YMCAs, senior centers, and other social service organizations. And they all work together in a coordinated way, which they've never really quite done before, to focus on prevention in the community. The goal of doing this work is to reduce those rates of preventable chronic diseases that I talked about before, very importantly, address health disparities, and reduce healthcare costs. So here I stand tonight, 5 years later, and I'm happy to report to you that our efforts are really making a difference in our communities for our residents. And they have been a success, and much has been accomplished. We have established, with the leadership of the Department of Public Health, 9 regional PWTF partnerships that join together the healthcare providers, municipalities, senior centers, YMCAs, et cetera, that I spoke about before. And this covers, these partnerships cover more than 1 million residents of the Commonwealth. The Department of Public Health early on identified 4 key areas of health and wellness for these partnerships to focus on as primary health conditions. Those include hypertension, asthma, particularly in children, elder falls, and tobacco cessation. They chose those conditions after extensive analysis of the conditions, the health conditions that are most prevalent in our population and that are most contributing to poor health outcomes and driving up healthcare costs. And also because we have good evidence base on interventions that can successfully address these particular conditions. Now, the partnerships had to address one or more of these priority conditions, but they also are able to address other conditions like mental health issues, addiction issues, obesity, and other conditions as well. Since its creation, the PWTF has increased access to preventative services, as I said, from nearly 1 million residents of the Commonwealth, and it's already yielding positive health outcomes and potential cost savings. A recently completed independent review, an audit, of the program that was conducted by Harvard Catalyst, which we required as part of the original authorization for the program, demonstrated very promising early results. Harvard Catalyst evaluation was actually based on just 1.5 years' worth of data, and that's quite remarkable to see a positive impact on health outcomes and costs in such a short period of time for health interventions. Given the late hour, I'm going to spare you the actual specific details on the results, but trust me, they are all published in the Harvard Catalyst report. So our action is needed tonight in order to reauthorize the Prevention and Wellness Trust Fund, because otherwise the funding will sunset in just a month and a half from now, June 30th. So this is really critical, important work we're doing tonight. If we were not to act tonight and this funding were to dry up, the existing partnerships serving many of our communities and constituents would dry up very quickly, would have to disband, and we would not be able to scale up this work to ultimately reach every resident in the Commonwealth, which is really the long-term goal here. The way we are funding this reauthorization of the Prevention and Wellness Trust Fund is through closing an existing tax loophole, and that relates to flavored cigars. We have long had a lower tax rate on cigars than we do on other kinds of tobacco products. That includes both cigarettes and smoke-free tobacco products. So what we do in this amendment is we raise the tax rate, the excise tax rate, just on flavored cigars. These are cigars with flavors like grape, watermelon, strawberry. We raise it to the same level as the current excise tax on other kinds of tobacco products. So it just brings it to parity with other tobacco products like chewing tobacco and tobacco mints. This amendment does not change the tax rate on unflavored or normal tobacco-flavored cigars. These products, these flavored cigars, are being targeted at young people by the tobacco industry. They're cheap, they're sweet, they're very appealing, and we've seen their rates of use increase significantly in our middle schools and our high schools to the point that they are now smoked even more than cigarettes are. So it's an important public health measure just on its own merits to close this tax loophole. But importantly, I think tonight we are marrying that with the ability to reauthorize and fund on a permanent basis the very successful Prevention and Wellness Trust Fund. So I hope you'll join me in supporting this important work that we are doing in the Commonwealth, which is moving our healthcare system from a sick care system to a well care system. Thank you very much, Mr. President.